This video will guide you through your at-home sleep test. Setting up this test will only take a few minutes to complete. You will be using the SleepView Monitor, a comfortable and easy-to-use device. First, snap the effort belt to the SleepView Monitor, ensuring that you hear both snaps click onto the belt. Wrap the belt around you and use the Velcro tabs to secure the belt snugly but comfortably. Adjust the belt so that SleepView is positioned at the center of your chest, above your breast. Next, remove the nasal cannula from its packaging. Ensure the nasal prongs are pointed upward toward your nose. Now, gently insert the prongs into your nose and pull the tubing behind your ears. Find the plastic slide where the cannula tubes meet. Pull the slide up to your chin so that the nasal cannula fits snugly. You may use adhesive strips to secure the tubes at your cheeks. Connect the end of the nasal cannula to the cannula connector. Once inserted, gently turn the connector clockwise to lock it in place. Next, connect the pulse ox finger sensor to the SleepView Monitor. Slide your index finger from either hand into the sensor so that it covers your fingertip with the icon of a finger on your fingernail. You should be able to see the tip of your finger through the top of the pulse ox. Remove any nail polish or acrylic nails, as this can affect the recording. Make a fist and then place an adhesive strip across the back of your hand to secure the wire in place. If an auxiliary sensor is sent with the kit, please attach it to the auxiliary port and refer to your patient instruction sheet. You will note that the auxiliary sensor light may remain off if you were not provided with an auxiliary sensor. Now we can start the test. Press and hold the On button, located in the front of the SleepView Monitor, for 3 seconds. The power light should turn green. Once the monitor is on, relax and take a few slow, deep breaths. Eventually, the lights for each sensor will turn green. If any light stays amber, that means a sensor needs to be adjusted. In this case, locate the sensor and adjust accordingly. However, it is normal for sensor lights to switch between green and amber as you move around. If you notice any sensor lights that are red, that indicates a sensor is not properly plugged in. Remember, the light inside the pulse ox sensor will always remain red, while the light on the SleepView Monitor should be green when sensor lights are lit. The sensor lights will stay on for 90 seconds, but if you need more time to adjust the sensors, simply press the On button again to turn the sensor lights on for 30-second increments. The power light will remain on during the entire test. Now, you're ready to sleep. Find a sleeping position most comfortable for you to ensure a strong recording signal. Try to spend some time on your back, as sleep apnea can be worse in that position. The test requires at least 6 hours of recording. Remember not to remove any sensors or turn the device off during the test, including if you need to use the bathroom. If any sensors fall off, simply put them back in place. After you wake up, press and hold the Off button on the SleepView Monitor for 3 seconds. If the lights circle clockwise in green, your sleep data was successfully recorded. If the lights on the device move counterclockwise in red, please review the tips on the instruction sheet for assistance. If you are using the monitor for another night, you will need to put in a new battery in SleepView. The SleepView Monitor saves all your recordings. Once you're finished with your test, you can remove the device and discard the nasal cannula and belt. Do not discard the SleepView Monitor and pulse ox sensor. Fill out any paperwork that may have come with the kit. Return the test kit right away to avoid delays of your test results. We hope this video helped you complete your home sleep test with the SleepView Monitor.